A very good afternoon. My name is Juergen von Hovell, and I represent the Johanniter Order in Texas. I apologize for my raspy voice, sounding a little bit like Dr. Fauci, but during the past 7 months of being cooped up at home, my vocal cords must have gotten rusty. First of all, a warm welcome to all of you, particularly to our distinguished guest speakers, the Dean of the College of Nursing at Texas Women University, Dr. Rosalie Mainous, and the Chief Nurse Executive of UT Southwestern Medical Center, Susan Hernandez. And a word of thanks to all who made today's Zoom meeting possible. At this point in time, hospital care is one of the main topics that move society, especially in view of the terrible corona pandemic. We, the German Johanniter Order, have been granting stipends to nursing students for several years, but my friend Henry Fink is going to elaborate on that much more in detail. Let me briefly give you a short synopsis of the Order's history and our present-day activities. The German term Johanniter means something like the followers or the people of St. John. It was Fra Gérard, a French Benedictine monk, who founded the order in the year 1099. He established a hospital in Jerusalem for Christian pilgrims who had fallen sick on the long and perilous voyage from Europe to the Holy Land. During the First Crusade, European knights joined the order and cared for the poor and the sick. They were known at the time as the Knights Hospitallers. Eventually, the order had to leave the Middle East and established itself first on the island of Rhodes and later on Malta. In Germany, by the end of the 14th century, the bailiwick of Brandenburg, as part of the Grand Priory of Germany, achieved a fair degree of independence and was allowed to elect its own Grand Master, and converted later during the Reformation to Protestantism. As the oldest Christian knightly order in the world, together with the Order of Malta and the Venerable Order of St. John, who all share the same history, the Johanniter are active worldwide, particularly, of course, in Germany, where we own and operate 17 hospitals, where about 400,000 patients are being treated annually, retirement facilities for about 8,000 people, 450 daycare centers, a nationwide ambulance service that in 2019 provided first aid in 750,000 cases. The Johanniter Sisterhood maintains its own nursing school. About 50,000 salaried employees and close to 100,000 volunteers care for people in need. I'm throwing out all these numbers just to point out that the Johanniter Order is not an insignificant fly-by-night outfit, but a well-established organization with a solid reputation. Here in Texas, our small group of knights with a great number of volunteers is involved in a multitude of charitable projects, like building wooden ramps for poor and wheelchair-bound people, providing Thanksgiving meals to needy and foster families, helping hurricane victims, joining Soup Mobile, a charitable organization in packing shoe boxes with essential products for the homeless for Christmas, volunteering in hospitals, serving meals to the homeless at the Salvation Army, sending letters of gratitude to first responding staff in Dallas hospitals, donating blood. What we lack in funds, we make up by idealism and enthusiasm. With that, I would like my knightly brother, Henry Fink, to provide more details on our nurses stipend program. Thank you.
Thank you, Juergen. And thank you, distinguished speakers, for joining us today. JHG Texas is a nonprofit organization incorporated in Texas by a cluster of the Knights that Juergen referred to. Our mission is to serve the poor and the sick. Our vision is a healthier North Texas, especially now more than ever because of the COVID-19 pandemic. We stay very focused for this reason on the well-publicized shortage of registered nurses in Texas that has been publicized widely in the press. The Texas Nursing Workforce Commission has projected a 20% shortfall of registered nurses in Texas by the year 2030. There are other estimates that vary from that, but that's the one that we've been following. And there's not only a shortage of registered nurses projected, but also a shortage of well-educated nurses with a Bachelor of Science in Nursing. And I believe that our speakers will elaborate on that. So at the conclusion of this session, I will discuss what JHG Texas is trying to do about the shortage of nurses. But today we are featuring two preeminent speakers with distinguished careers. And the first one, but in addition to those two distinguished speakers, we also have already joining us two student nurses who are JHG Texas nursing scholars. And we'll have a third one joining us as soon as she can get out of her clinical rotation this afternoon. They keep these student nurses very busy. So without further ado, and I will ask all of our speakers to be sure that their microphone is unmuted when they start. Without further ado, I'd like to introduce Dr. Rosalie Mainous, the Dean and Professor at Texas Woman's University College of Nursing. She's been there 1 year where she's been leading Texas Woman's to greater levels of excellence. And she previously, before joining Texas Woman's, worked for the American Association of Colleges of Nursing, where she directed the leadership development of 825 academic deans nationwide. And she was responsible for the intellectual content of 5 national leadership meetings. With a career spanning 40 years, Dean Mainous is proud to have been selected in the 2009 cohort of the Robert Wood Johnson Foundation Executive Nurse Fellows Program. And she was inducted as a fellow by both the American Association of Nurse Practitioners and the American Academy of Nursing. So Dean Mainous, I'd like to turn the microphone over to you.
Well, thank you, Hank, and it's such a pleasure to be here, and I so enjoy all my events with JHG, and I'll see if I can highlight a few of the things about COVID and COVID-19 and also the value of the relationship between academic nursing and philanthropy. A College of Nursing is not an island, it is a hub for training and education and research and practice, and it's where we socialize the next generation of professionals. And it's connected by many spokes to partners, and those are partners are hospitals, other colleges, federal agencies, and of course, philanthropists. And without these key relationships, colleges would struggle to survive, but instead having a relationship with JHG allows us to thrive. So first I want to announce that only yesterday we awarded 10 scholarships and heard some wonderful stories from those students that got the JHG scholarships. One came from a family of 11 children. Another had lost their job due to COVID. One didn't have the funds for the final semester of nursing school, was not going to be able to finish. All of these were assisted through JHG, And we do have one of our students here today, Thor Judson, who is the JHG Texas Nursing Scholar and was given the scholarship in honor of Gerard L. Regard. I also want to announce quickly an initiative that was brought to us by Todd Weiss with the JHG, which is very exciting. Todd has been promoting a collaboration between higher ed and faith-based institutions to solve public health problems in the areas of high need. He has been working closely with Dr. Gabby Smith, a psychologist at TWU, who is investigating cervical cancer in immigrant Black women in an underserved area of Dallas. We are in the process of identifying a JHG scholar who wants to participate in this research and have a research focus as part of their academic career. They will work with this research team, learn how to address health disparities, and we're working with one of the faculty from my college, Dr. Fu-Chin Liu, who's also published in this area. Dr. Smith leads the team, but when they go to publish manuscripts, the JHD scholar will be included and will be allowed to participate in that opportunity. I think we can start today with the discussion of COVID. The year 2020 was named by the World Health Organization as the year of the nurse and the midwife, and quite the year it has been. We have seen pockets of excellence in our healthcare system. We have a longer life expectancy. We still have some work that we need to do on health outcomes. There are opportunities and challenges, and nurses are central to all of these. The COVID-19 virus has exposed flaws in our healthcare system in terms of reporting and testing and our ability to mobilize for a crisis, and we haven't had enough equipment or PPE. Currently in the US, we have over 8,320,000 cases, with 72,342 reported in the last 24 hours. We also have over 221,000 deaths. And nurses have become the face of those in the trenches fighting COVID-19. We have been the largest group of healthcare providers to respond to this crisis. And our nursing students, while to date have not been assigned directly to care for COVID patients outright, they have supported the overburdened healthcare system by trying to care for the rest of the patients in the hospital. So we are still in clinical rotations, taking care of new mothers and babies. We are still taking care of patients with asthma and diabetes, people who are receiving knee replacements, children with heart defects. And we have participated in drive-by testing, and we have manned phone banks that help to answer questions on COVID-19 for the public. Registered nurses have been the backbone of the healthcare system that's dealing with the pandemic, and our nursing students have been part of the state support in Texas. We have learned much in this process and have found out that Texas nurses have a heart. They stepped up when they dealt with an Ebola outbreak in Dallas. It's my understanding that happened before I arrived, and they are here now. We have worked hard to make our nursing students a part of this experience while not unduly putting them at risk, and we are very proud of them. When I asked for stories about nurses in the trenches with taking care of COVID patients and lateral to the COVID population, I got 10 pages of responses from my faculty, and I couldn't possibly mention them all here, but it was tremendous to see the work that my faculty and the students are doing to try and support the work of the frontline providers in our hospitals and our clinics. Nurses are heroes. They're heroes to the American public, heroes to the patients, and a part of the equation are devoted and committed organizations such as JHG, which help us train the professionals of tomorrow. These are the nurses that are going to care for us in the next health crisis, and there will be another healthcare crisis. There always is. I want to share a picture with you for just a second. I love this photo. This is actually a doctoral student of ours with a physician getting ready to start a case in the operating room, and they were prepared to intubate the patient and begin with the surgery. So you can imagine how long it takes to put on this much garb, and then sit through a procedure for a couple of hours with all of us on. It is quite a burden. I have a great deal of respect for them. I work behind the scenes to try and support them to the extent possible, but I have not been front line. So my hat is off to them. More nursing students are needed with diverse backgrounds that go into practice environments that are underserved and have been hardest hit by COVID-19. And we all know that this disease impacts people of color disproportionately, those with pre-existing health conditions, and those with health disparities. This pandemic has exposed our need to prepare more nurses in population health. And we are currently altering our curriculum for more of an emphasis on population health, community-based care, and primary care services. We are trying to move to holistic admissions in our college. Many are qualified that have not had opportunity. Their financial status has been a piece of that. But relying on a single data point does not make good sense, such as a GPA. We're going to look for a variety of factors for admission. May include things as healthcare experience, may have them write an essay, first generation college, GPA of course, but goals and aspirations too. Let me speak just a minute to the value of a BSN. Surveys go back 2000, 2004, 2008 that looked at the effect of a baccalaureate education in nursing when compared to an associate degree in nursing on career trajectory. They found that over time, that lifetime earnings are higher and it provides a stepping stone to graduate education. Quality of care can be an issue as well, and many studies supported increased quality outcomes with a BSN prepared staff. For example, one study was based on American Heart Association guidelines and American Hospital Association data. Said with a 10-point increase in the number of BSN nurses that you have in your hospital, you had a 24% greater odds of surviving to discharge after cardiac arrest and also being able to be discharged with good cerebral performance, 24%. And hospitals with higher proportions of nurses educated at the baccalaureate level or higher, surgical patients have a lower mortality rate. The Institute of Medicine in 2011 recommended an 80% or greater workforce qualified at the BSN level or higher. And according to the Texas Board of Nursing data online, what I found, and my colleague may have even better data on this, but I found that 58.3% of nurses in the state of Texas have a BSN. Nationally, that number is 56%. So we are ahead of the national average, but we still have quite a ways to go. Not to say, I do want to say that there is also value in an associate degree, and that is how I started out. And we all have to start someplace. And some may use the associate degree as a stepping stone to a baccalaureate education and provide a needed income at the same time. But just as the BSN helps with upward mobility to a master's degree, the associate degree is the start for many to a bachelor's degree. We look to produce high quality professional nurses, not just any nurse, in an environment of reasonable cost to the student, exposure to world-class faculty, innovations in telehealth and informatics, clinical partnerships with hospitals with international reputations, one of which is Parkland Hospital in Dallas. Parkland's nursing program rolled into TWU in 1954, and on the strength of that institution, it was the foundation for the baccalaureate education at TWU. We continue today with a strong partnership with this institution and many others. We also expose our students to international opportunities, expanding the worldview. We offer opportunity for service learning in Peru, Vietnam, Korea, Indonesia, Amsterdam, the UK, to name a few. And as I was putting this together, I thought how wonderful it might be to have a German experience in the application of biomedical engineering in the ICU. For our nurses, that would be an excellent experience. My own research was looking at cerebral blood flow velocity in preterm infants using near-infrared spectroscopy and ultrasounds. And these international experiences are life-altering for students because it gives them a worldview they would have never had before. And it is only because of the support of philanthropy that these students can study and train at TWU. A quick piece on barriers to enrollment. In terms of recruitment, even though the work is hard and the hours are long, we have been fortunate to have high interest in nursing as a career. And according to the Bureau of Labor Statistics, as Hank referred to, nursing is going to continue to be a growth career through 2028 at least. We need a pipeline in order to meet the healthcare needs of the public. The biggest barrier to enrollment is financial stability. And we are a university that is predominantly female, and our students come from a variety of backgrounds. Some are single parents, some are working full-time jobs. Even the addition of an extra fee is sometimes too much. Many are first-generation college students. They have not had the role models that I know I was afforded, and they come from families of hard work, but are not familiar with the barriers and hurdles necessary to move through or how to adapt to those to move through a university system. They have to play catch up, and they need support to enter the system. One other enrollment challenge is not enough spots in the class. We are implementing several strategies to address this one, but it includes starting new programs and opening more seats. We're also developing a pathway through our nutrition program and another through child life in the College of Education for people to become nurses. We are trying to innovate every day to address this shortage. To produce high quality professional nurses, not just any nurse, we must provide academic support strategies for them once they arrive. It is not enough to just admit them and hope for the best. We need to support their matriculation, retain them, and get them to graduation. And I want to speak in one way of we're doing that, and it's with JHG. Not only do they provide needed scholarships, but I'm excited to announce the upcoming ribbon cutting for the Mike A. Myers JHG Texas Student Academic Success Center. That was quite a name, and I thought about calling it the SAS Center to break it down a little bit. We'll have either a spring or fall opening, whichever is going to be the safest for our donors. And we will have a blowout reception. And of course, we want our practice partners in the area to attend as well. This has been a vision of the Associate Dean on the Dallas campus. And while freshmen and sophomore students have had support, juniors and seniors have not. So they have not had support in the area of the psych mental health course, pediatrics, gerontology. And so by providing tutors, which we're currently seeking, in a peer-to-peer tutoring program, it can make a difference in the students completing the program and changing the socioeconomic status for their entire family, or failing the course and dealing with emotional and financial consequences. Space has been identified in our building, a plaque has been made, equipment is being ordered. Only the presence of COVID has slowed our startup, in part because students are only coming to campus for labs, which are very tightly controlled. But we will realize a stream of support for students who need a little bit of help. And we want to thank JHG and the many individuals and businesses that have made this funding possible. Thank you for having me today to be able to talk a little bit about our student population, of which I'm so very proud. And I'm glad that we've made the acquaintance with JHG, and I hope we continue to have a long partnership. Thanks.
Thank you, Dean Mainous. We enjoy our partnership very much, and you're a wonderful dean and college to partner with, and we just think that you all are the greatest. I'd like to turn our attention now to the nursing scholars that are in the education pipeline now, on their way to earn a BSN and eventually to seek accreditation as a registered nurse and to enter the nursing workforce. We have 3 lined up. I'm not sure if the third one has been able to join us yet, but what I would like to encourage you to do is, when I bring you to the microphone, is to speak what you feel and what's on your mind, and about your goals, the challenges you have in attaining your Bachelor of Science in Nursing, any concerns you have about COVID-19 and oh, I see the third one has joined us, Ms. Belu, thank you. So I would like to turn the microphone first to Thora Judson from Texas Woman's University College of Nursing. Thora, would you like to make some comments?
Yes, I would love to. So I'm Thora Judson. I'm currently a senior one student at Texas Women's University. And I first of all would like to say thank you so much for this opportunity for this scholarship. COVID-19 has definitely impacted my education. It's made a few barriers. As a junior 2 student, I did lose out on quite a few clinical hours. Although as a senior 1 student, our clinical professors are finding opportunities for us, and they're really pushing us in each clinical that we have to find a way to make up for that time, but they're not punishing us for missing out on those hours either. My experience at Texas Women's University has been some of the best time in college that I've had, even in my prereqs. All of my professors have been amazing. They really push you to your limits, but when you need a little bit of help, they're there to help guide you as well. They're not necessarily holding our hands because we are nursing students and they want to push us to be the best that we can, but they're doing the best that they can despite COVID-19 and everything else. But I know that I got lucky with my last clinical rotation in women's health. It really pushed me to know what I wanted to do with my BSN. I would love to become a NICU nurse for the first few years. And then I would love to go back and become a midwife as well. And then my ultimate dream and goal is to become a professor of nursing students, to push them like my professors have pushed me, and to help future nurses become the best nurses that they can possibly be.
Well, that's wonderful, Thora. Thank you so much for your comments, and it's so nice to have you join us today.
Thank
and
you.
I'd like to turn now to Nabia Kana from the University of Texas in Arlington, College of Nursing and Health Innovation. Nabia, tell us about yourself and your thoughts about all this.
Okay. Thank you for this opportunity. My name is Nabiha Kana. As you said, I'm from University of Texas, Arlington, senior 1 student. First of all, I'd like to appreciate for your generosity for the scholarship and everything. And I'm a mother of 2 children, and one of my child is diagnosed with retinoblastoma, eye disease, a cancer eye disease, rare eye disease. So it's like I'm struggling between schoolwork and taking care of my child, and having this kind of help, really it helps me a lot, because I have to take my child every month, every 3 to 4 weeks to Houston at MD Anderson Cancer Center for treatment. So when you get this kind of help, it will relieve some of your stresses. You have to pay for insurance, you have to pay for gas and the transportation and everything. And COVID-19 affected me in different ways. My husband was working, he's not working right now. And I don't have, the other fellow students said, I don't have the clinical hours that I needed. We're not going, we're doing most of the clinical hours online. So it affected me in many ways, personally and education-wise. So yeah, this is a challenge currently that I'm struggling with, but thank you. And if you have any question, I'm willing to answer. But yeah, thank you for the opportunity.
Sure. Well, we thank you, Nabia, and God bless you with your challenges. And we hope that you are able to overcome them and to achieve your goal.
Thank you.
And thirdly, we'd like to hear from Alexandra Sky Ballou from the University of Texas in Arlington, College of Nursing and Health Innovation as well.
Hello, everyone. My name is Alexandra Ballou. I go by my middle name, Sky. I really do want to take the opportunity to say how grateful I am for everything that you have done for me and for everyone else. It's very supportive, especially in times like this that are extremely hard. I work at Parkland Hospital, and during the pandemic, I was COVID facing. So I was on the front lines, and it completely changed my view on nursing. I've been a tech for about a year now, And it just pushed me even more to want to go out and help others. I now know, after being COVID facing, that I want to go into ICU, and I want to travel to impoverished areas and provide care in that way eventually. And I would love to do that. So COVID has really been it's been very closely related to me in the sense of I've gotten to see it firsthand and feel the emotional side of it, which I did not anticipate going into taking care of those patients. But it has pushed me and allowed me to grow and expanded my gratefulness for life in a way that I did not anticipate. So I take every day, just day by day now, with gratitude, and realizing that a lot of all of us that are on this path are going to make a really big impact in people's lives one day. And I'm so beyond grateful to be able to do that and to help others and support them. So thank you again for all of the support. I haven't been able to work as much due to school, but when I do, I love it. So this support in any way is fantastic. And I hope to, with the rest of my fellow nursing students, that we can continue to help and make everyone proud and continue to portray nursing as the amazing career that it is and taking care of others. So thank you for the opportunity.
Well, Sky, that's really impressive. And bless you for all you're doing there in your work facing COVID and also trying to earn your degree. And we hope that with the help of JHG and the help of your school, that you achieve your goals. I'd like to turn next to Mrs. Susan Hernandez, who comes to us with great credentials and a distinguished career. She has an MBA in addition to a Bachelor of Science in Nursing, which is a unique combination. And she's also a registered nurse and currently serves as the Health System Chief Nurse Executive for UT Southwestern Medical Center, where she oversees the nursing practice for approximately 2,500 nurses throughout the university hospitals and 58 ambulatory clinics. Under Mrs. Hernandez's leadership, UT Southwestern achieved magnet status in 2016. Magnet principles align seamlessly with her leadership style. She is passionate about the well-being of not only the patients, but also her staff. And she advocates for the voice of the nurse through all levels of her organization. So, Susan, I'd like to turn the microphone over to you. We'd love to hear from you. And thank you for joining us.
Thanks for having me. I'm excited to participate. It always energizes me when I get to hear from academic partners and students, and also share appreciation to all of you who have given people opportunity that might not have had an opportunity at all, or might have had a harder path to travel. As you've heard from these three students, you're making a difference, a big difference. So thank you for doing that. So I too have many stories about COVID and the impacts of nursing, and I hear them as I round. I hear them from friends and neighbors. I have had some experiences in my own family, and it is challenging. I think one of the things that you have to remember from a nursing perspective is just what the three ladies just described. This isn't just about your shift at work or your clinical time in the hospital learning. It really has had a huge impact on everyone in their entire lives, whether you're the single mom who decides to go back to school and but also needs to work, and then suddenly your child can't go to daycare or to school. And so how do you balance that? How do you figure all that out? You need to pay your bills, you want to finish your degree, but you also want to take care of your child. I think there have been huge impacts there, and scholarships definitely help. I too started with an associate's degree in nursing, and so I have a soft spot in my heart for that. And yet I do know the value of the BSN, and I'm glad now that I pushed on and have continued my education. It has made a difference for me in terms of my understanding of the profession of nursing, and yet I still did a great job as an associate's degree nurse when I graduated. And so just providing opportunities and challenging nursing students to go on, I think is part of my role and our role as a nursing community to keep people going. When I think of the stories that I want you to hear, I also want you to know that sometimes little things matter. A simple gift card to get a meal when you are working in a time of a global pandemic and worried about your family, it goes a long way. It makes a huge difference. And the Dallas and DFW community and surrounding areas have really touched the hearts of the nurses. I also think it's been a time for nurses to really contemplate why they do what they do. So, you know, Sky mentioned how it's really spurred her on as a tech to even go more passionately into her nursing career. And I think that's true for many. It's also, you have the flip side of that. You're afraid. We didn't know how this virus would impact the nurses who are at the front lines. As Rosalie mentioned, people were concerned about PPE. At the beginning, we were trying to figure out what was the best PPE to protect our people. And yet it was the nurse that was going into the room most often and for the longest periods of time. And so I think many of our UT Southwestern nurses would tell you it has been scary at times. It has been invigorating at times to see people turn the corner. It has been sad at times for those who don't. And yet they wouldn't trade this time, most of them. It has really helped them gather back their passion for why they became a nurse. And they have been innovative. They've been creative in how we provide care. They've been compassionate. I mean, think about some of these folks are in the hospital for months. How do you as the nurse make that connection with their loved ones so that they don't feel alone? How are you that individual that's in that COVID patient's room trying to connect with them? And so we hear lots of those stories. It is true. We've had to change the way that we help support the training of nurses. And I know that's been a challenge for all of our academic partners trying to figure that out. It's been a challenge for us as well. In the beginning, we certainly didn't want to bring in more people than we needed to within the walls of the hospital because we were concerned about burning through PPE too quickly. That is loosening up and changing, and we are finding creative ways so that students can come back into the environment and continue on with their hands-on learning outside of the COVID units. You may know, I'm sure people are paying attention to the news, hospital volumes are going back up with non-COVID volume. And so that does allow for more opportunity for our nursing students to step in and learn side by side with the experienced nurses at UT Southwestern. So, I think we would all say that we've learned at times, we've struggled at times, and we've been thriving at times. And I think that will continue. I'm not going to repeat some of the numbers that Rosalie shared. She and I are clearly reading some of the same information, but I do think we've got to be thoughtful about the fact that we have a supply and demand issue in the state of Texas that is bigger than some of the other states we'll see over the course of the next several years. When the Dallas Morning News published my thoughts, and I call it my thoughts because it's just that was how I felt about things. There had not been a new release from the Texas Center for Nursing Workforce Studies. And so those numbers have even changed. They released new numbers in July of this year. And it actually looks like our gap's going to be even greater. They are quoting 57,000 are in deficit by the year 2032. So for Texas, this appears it's not going to go away. And when I think about that as a nurse leader and not simply as the chief nurse executive in a healthcare organization, I think of how do we partner with these schools of nursing to try to get more seats in the classrooms and try to support more faculty opportunities and try to support more hands-on experiences in the hospitals, because I think we're going to have to get creative. The other thing we really need to bind together to do is get to young people early. I love what I do. I love what I do every single day. And I'm still passionate, 25 years in about what I do. And so I want to share that passion. I want to be able to find those students who are out there and maybe open a door to let them see what a health profession could provide for not just them, but for their families. When I think of certain cultures in our area, there are differences in what people value. And some individuals, some families, and some cultures value work more than they value academic preparation and a professional career. And that's not a criticism, it's just a simple fact. And so I think it would be great if we could find ways to partner with students early on to try to get them into health professions and encourage them to do this work. The other thing that I think is valuable is for us to be a positive impact in the lives of others, to help them see they can do it. Nursing is not easy. And yet, if you apply yourself, you can do it. And it's so incredibly rewarding. I think service-oriented people, it is the prime spot for those folks. And I would hope that we could all go out and try to encourage those folks to really give it a shot and try to see what we can do. As Rosalie mentioned, there's a lot of value in BSN and above preparation for nurses. We still have a gap. We clearly did not meet our 80% goal for having bachelor prepared nurses out there. And so we need to continue to work on that. As she mentioned, there is a connection through quality and safety outcomes related to that preparation, as well as years of experience. So the more we can get individuals in early, help support that passion for nursing, help them further their education, and then give them a great work environment to practice in, I think we're all going to be better off in the long run. I think about what it'll be for me when I need more care than I do today. And I want to know that we've invested in folks who really are wise about what they do and have the intellect and the compassionate skills to take care of all of us as we need it. So I would look forward to having more open dialogue with each of you. I know you wanted to make sure that we had some Q&A time with this group. So I won't share more facts and figures because they've been shared, honestly, which is great. We're all thinking about the same things. But a special word of congratulations to the nursing students. Keep it up. You will be done in no time, and it's a wonderful career. And I will look forward to seeing you blossom in the future too into whatever you want to become.
Oh, thank you so much, Susan. That's a wonderful presentation, and I want to thank all of our speakers for your presentations and for sharing your thoughts with us. It's an important topic considering the shortage of nurses and that it doesn't seem to be going away, and that we do have to be creative and think of ways to help fill that gap. JHG Texas is responding to that challenge by providing nursing scholarships to students from low-income families who qualify originally for a Pell Grant or a comparable state grant, because we've noticed that we've learned from the colleges of nursing that about 50% of the students are financially needy. And that it's quite a barrier, as was mentioned earlier, to their pathway to becoming a nurse. So we just do the best we can at JHG Texas by providing these nursing scholarships. So far, we've been doing this for only 4 years, but in the past 4 years, we have awarded 43 scholarships to JHG Texas nursing scholars. 22 of those scholarships were only this year. So we're gathering momentum. We started out slowly. We crawled before we walk, and now we're walking and running. 9 of those scholars have already graduated. So those are measurable outcomes to this effort. And I saw an interesting, if you want to do the math, for people who like to do the math without getting too granular about the math, but the supply of nurses can affect, as I understand it, and correct me if I'm wrong, ladies, but the supply of nurses affects hospital bed capacity. That if there's a shortage of nurses, there are unattended beds, which could restrict capacity. And if we assume that a nurse may attend, say, 3 beds in a COVID ward, and the average length of stay is about 15 days, I know it varies from that, but let's just make that an assumption with 3 beds and 15 days, our 9 JHG scholars who graduated within 1 year would would free up enough bed capacity to care for 459, that's the multiplier result of those numbers, COVID patients in 1 year. So that's a simplistic formula. It's not accurate, but it gives you an idea of what the potential is of having nurse graduates entering the nursing workforce. So what a difference. And we have about 34 more scholars who are about to graduate within the next 2 years. So imagine the impact that that has. So we're pretty excited about this whole thing. That's all I had to comment. And I learned a lot from your comments about the shortage of nurses and the need to have better educated nurses. Marcus, do you have any chat messages for Q&A? How are you coming along with that? Are you there, Marcus? Are you muted?
I was muted. I have had
Okay.
issues with my phone and then the background. That's the whole thing. I'm trying to point it up to the screen. Okay.
So do you have any particular questions that have surfaced for these wonderful speakers?
Yes, there was actually one, and one was related to the impact as the fall, and I'm gonna have some background noise here, the impact as the fall is heading our way with the flu season and everything, and what the forecast on that is. Susan had mentioned the non-COVID based hospitalization increasing, but primarily as precautions and things as it relates to these other viral diseases that are coming our way and the impact they may see, particularly as it relates to nurses. What we see in the educational sector, teachers get sick because they're surrounded by kids. And is there any thoughts about nursing?
So we are very concerned about that. And actually, if you take a step back, we're also concerned about nurses getting sick in the community just from us loosening the reins a little bit in our community living. As we've seen, we're having another small surge go up right now. And we have some real concerns that that is going to impact our staffing levels because people are tired of not being with their family and friends. And so I do think that outside the hospital setting, people are taking some risks. It's not going to the restaurants. It is what we're seeing is more around family gatherings, and one member of the family has it. They don't realize it. They all have a meal together. They feel like they're separated enough, but they are, together for longer periods of time without wearing a mask, eating a meal, and less than 6 feet away. And it is infecting more individuals. So we do have that concern even now before flu season hits. There's also a little bit of an unknown of will people get their flu shots? Are they afraid enough that they will get their flu shots, or do they think, well, I'm wearing a mask anyway? So I do think there will be some impacts of that in the community that could then spill over into our professional workforce as well. So we are thinking about that. We are constantly hiring, to be quite honest, trying to keep some great relationships with contract nurses, although those folks are going to be high in demand because this will hit the whole country, not just us, but trying to just have true backup plans to be able to care for those patients. The other thing we have done, we have a year-long nurse residency, and that's how we bring in all of our new graduate nurses. And over the course of the last year and a half, we've upped the number of nurse residents that we've taken in, which has really helped us have enough workforce even before this pandemic hit. So I think there are still a lot of unknowns about that, and yet we're all doing what we can just to try to be prepared.
Super, thank you. Todd, you had a question, if you would like to ask it, please.
Dr. Hernandez, I'm sorry, Hernandez, I was thinking of Ron. Could you speak to the need to innovate some healthcare solutions moving forward? And can you comment on the need to have preventative or wellness solutions with respect to public health?
Sure, and I would welcome Rosalie to join in with me on this as well. Preventative health has been important all along, but I think now more than ever, people will pay attention to it. I also think that our use of telehealth will help us there. Some of us, and I say us, we're slow starters on sort of deploying our telehealth functionality. But that can really help us see what's going on with patients out in the community, keep them from having to come in, but stay connected, which could help us on the preventative side. So I do think that that will help us. I think in nursing, we're going to have to get creative in terms of our training, not just how we provide care, but also the training efforts. I think we've all had some questions about if you can't truly get in and touch patients as a student, how will that impact us? And so I'm really glad to see that we are able to do that. We are all fortunate in our local area to have lots of connections to simulation labs where you can simulate care in those environments without real patients. So I think that helps us, and we'll continue to enhance our ability to get nurses trained and to help them practice in different ways. If you think simply of how we've cared for the COVID patients, physicians, advanced practice providers, and nurses and respiratory therapists, many have gotten very creative about how we provide care, even from things such as how do you keep the ventilator outside the ICU patient's room and yet attached to the patient in the COVID room so that you can manipulate that piece of equipment and yet not have too many access times within the room of the COVID patient. So I think you will continue to see those innovations evolve. Rosalie, you want to add?
I had a few things. As you all know, our futures are very closely aligned with the clinical practice arena. As their census goes up and their nurses get more stressed, it's more and more difficult to take on students. Then we need to sort of look at other ways to train students and fall back to simulation and all those kinds of things. I'm hoping, the patient's got to come first. And I'm hoping that as we probably are going to go through a pretty rough time here this fall, that we can think of some innovative and creative ways to get the patient taken care of, get the student trained, make sure that the hospital nurses aren't overburdened. I think with some, coming to the table and putting the minds together, I think we can come up with some things. I really do. In terms of public health initiatives, we are focusing more and more on that in the curriculum. And I can tell you that some of the latest research that has come out has said that if you have your flu shot, you're 3 times less likely to get COVID. So there is some protection from a flu shot. But we're in the early stages of research with this disease, and that's normally I think it takes 4 years to get a vaccine to the table and an immunization program going, and we are going at a lightning fast pace. So there, we're keeping up as best we can, but we're still making sure everybody's safe and we're following all the rules. I think that one of the things we're going to have to look at in terms of outcomes is have we still been able to give the student the experience they need without the number of clinical hours that they were getting? What are their NCLEX scores show? And so we're going to watch that very carefully. We believe that we have been able to train them in a slightly different model. And one of the things that we're getting ready to pursue is virtual reality. So simulation, but virtual reality and augmented reality. So I think we're going to have to continue to expand and look at other ways to train students rather than the traditional way. Up until the Future of Nursing report came out, we'd pretty much been training nurses the same way for 40, 50 years. So it was time for a change. And we're excited to have partners such as Susan to be able to test new models and for them to also give us feedback on where we need to tweak things. So
one other thing I will add that I think Rosalie and I and other colleagues are going to be watching is how COVID impacts the desire for people to go into nursing. I mean, there's one side of the fence and that would say, but they're heroes. Let's be heroes. And that's so exciting. And then there's another side that says, oh, no way, I don't want to be put in that situation. So I think we're going to have to keep our eyes on that as well. I have seen several nursing colleagues retire a little bit earlier than they would have because of this. And so I think there's going to be a lot of factors that we've really got to keep our eyes on over the course of the next couple of years to ensure that we can bridge this gap of supply and demand for the future.
A lot of what we're working on at JHG Texas is faith health side of the equation, and Dean Mainous spoke about that. And what that really is working and aligning more with faith-based groups, and that is direct access to the public, where they exist, how they exist, in all their myriad of public health issues are foremost and forward facing. So we're working on that side of the ball too, in addition to Hank's unbelievable fundraising efforts. We're trying to provide not only for the scholarships and learning, we're also trying to plug into the public health communities who need it the most. And we are in front of the ones that need it the most. So I have absolutely loved the innovation that I've seen come out of the medical profession here recently. Super excited to work with Dean Mainous on some things. Look forward to working with whoever wants to work with us on these problems, because it's not going to go away. It's only going to exacerbate if we don't address this situation. And so to all you nursing students out there, I want to say thank you so much for your willingness. You cannot imagine how happy it makes us feel to have you take advantage of this programming and there's wonderful institutions that are training you. So please continue your studies. Know that people are working on your behalf behind the scenes to raise funds for you to attend school. Know we're working on scenarios for which you can plug into and work and get practical skills and develop your profession. We are working pretty tirelessly at this point to try and make these things happen. But I don't think people realize that there are many horses pulling for this effort, and there's many ways to be on board. And we just encourage you to do your piece to this puzzle, because you're invaluable in the total equation. So thank you again for everything. And deans and heads of schools of nursing, you guys are priceless. You're absolutely priceless. Thank you so much for your roles, your vision, and the clarity for which we can plug in and work with you. Because I think as we go, and I think as time proceeds, we may develop some things that can be transported to the world. So I really, really hope for these things, and we're working on them. So God bless you. From the bottom of my heart, it's just been absolute privilege to work with all of you. Thank you.
Thank you, Todd.
Nikki, you had a great question. You want to follow up on that?
Yeah, it goes a little bit back to the discussion we had on taking care of the nursing, changing a little bit the training that they're receiving before they go into the actual world. And I'm trying to find out, do you have any training implemented for the
And Nikki, you have some terrible audio, but I'll try to read your question out. I don't know if, can everybody understand it?
We could not hear.
Okay, the question was, is there support for the mental health of the COVID nurses as they're going through all these challenges?
I'll start. Absolutely, there's support for them. And every organization is doing this probably in different ways based on the culture of that organization and the access to resources. But at UT Southwestern, we have had something called the Nomad program before COVID started, and it's about moral distress and how we wanted to provide a forum for not just nurses, but the whole care team to be able to speak about difficult situations that distressed them and that could put them into a space of burnout, in which we want to avoid at all costs if we can. So that program was already going. We've had many people reaching out for that. We have our employee assistance program. We have chaplains who are rounding. We've done things like pet therapy has shifted from the patients because they don't come into the hospital, and they'll be outside the doors at certain times of the day for our staff, just for our staff, to add a little bit of joy and a moment of peace. And it is unbelievable the number of staff members that will trade out to go take a break while those pets are there. And just the way it just gives them a release in the middle of their shift to be able to keep going during that shift. There are several things offered in that arena. I think the challenge for nurses sometimes is reaching out and taking advantage of those resources. So we're continuing to keep our eyes on the staff involved to make sure that if we see something as a leadership team, we can help swoop in and pick them up. They have lots of things going on in their homes, as I mentioned earlier, that we may not even know about too. And if there are resources that we can give them, we want to do that to help support the whole package of their life at this time.
Thank you. This does this work better with the audio? I hope.
Yes.
Yes, thank you. That sounds great, and I'm glad that you're able to help and support them.
Marcus, do we have any other questions?
I just wanted to ask if the three nurses on the call had any questions, concerns, anything they wanted to highlight. I know Sky had mentioned if she was able to ask questions, and I just wanted to make sure they had a moment if they wanted to ask anything. Silence is golden. I don't think anyone had it.
Yeah, they
Yep,
answered
there
all
it
of my questions with the great numbers that they provided. They really covered everything. I was going to ask on questions about the, I guess, the differences and how COVID has affected minorities, but they addressed that. So everything was great. Thank you for everything.
Well, just to wrap up, I'd like to thank our speakers and for your wonderful presentations. I'd like to thank the students for joining us, and for my colleagues at JHG Texas. Thank you for chiming in with your questions and your comments. Anyone who watches this video, since it is being recorded, if you'd like to learn more about JHG Texas and what we do, please kindly visit our website, jhgtexas.org. And also to learn more about the Nursing Scholarships Program, please visit our website at jhgscholars.org. And thank you very much, everyone, for joining us.
Thank you. Okay. And I will end the call now. Let me see.